Thank you, Will. I think it's probably best to say a huge thank you to Will to begin with for standing in at such short notice, and much appreciated. And also thank you to everybody in Diabetes UK for the kind invite. And it's a fantastic day. It's really good. I mean, as you look at the program, it's got so much variety, so many things. So I think, as Will mentioned, this is a community. So be kind, be nice to each other as much as you can, as you would be in normal life. I would hope, there are things you might agree, things you might disagree, but, we can all agree to disagree in many things without being, unkind or rude to each other. So let's keep that sort of thought process going. And I think one of the things that Will mentioned was about the relevance of emotional health. And I think it's fair to say, quite rightly too, it's getting its just position in the world of diabetes care. We're getting to a position where people are starting to think more about it, talk more about it, commissioning services, and that's the way it should be. So no better person to start the day than Rose Stewart from Wales, who has spoken at this event for the past few years. And I think it's always a reflection of as to how popular it is when you're asked back. And there we go. So Rose has been asked, but I personally had the pleasure of working with Rose many times in the past, and especially during these pandemic times. We worked together to create the account Diabetes 101, which won a few awards, which was great for the QIC, etc. But, the dedication Rose has towards her particular area, and great champion, great supporter, and as ever, an eloquent speaker. So without further ado, without me hogging any more of time, because this is more about the speakers, it's more about the questions. And keep those questions coming. So without any further ado, so let's bring it to start, and over to you, Rose.
Hi, everybody, and thanks for coming to the conference today. It's great that so many people are interested in this area. And I'm here to talk to you about the emotional health and the psychological impact of diabetes technology. And it's often a bit that gets a little bit forgotten when we're thinking about how new technology gets developed and used. So I want to start us off with this quote to begin with, which is a Douglas Adams one, which is, technology is a word that describes something that doesn't work yet. And in terms of diabetes technology, where the ultimate goal is to essentially just emulate a human pancreas with very little input from the person with diabetes, we are definitely not there yet. There's still a long way for us to go. So today we're going to think about what some of those next steps might be, not just in terms of developing the biology of the technology, but how we interact with it. And to think about this, I'm going to introduce you to something that is called the Biopsychosocial Model. And that sounds incredibly fancy, but it's actually quite simple. So it's thinking about the way that we as humans might use a technology and generally interact with the world around us. So in that top circle, you can see the biological. So this is what happens to our bodies and inside of our bodies. Then we've got the psychological side of things, what happens in our heads, how we think, and how our mood interacts with us. And then the third element is the sociological, which is how we interact with those around us. So that might be our friends, our families, or into the wider world of who we work with, our educational needs. And you can go really big with this and think about things like the political context that we're living in as well. And it tends to be that when new technology is developed in the medical field, there's a whole lot of focus on the biological side of things. But in terms of the psychological and the sociological side, this is a bit that gets neglected. And because that bit gets neglected, this is often where we have the biggest issues when it comes to diabetes technology and making it work effectively. So like I said, the biological side of things is the bit that tends to get the most attention. And before I start going through all of this, I really have to point out that I am not against diabetes technology at all. It is a beautiful, wonderful thing. It has changed so many people's lives for the better. And what I am presenting this information to get you thinking about is that what do we need to really make it better, to take it to that ultimate step where it really does work for us. So we know that the biological benefits of diabetes technology have been absolutely huge. So particularly when we think about the new forms of blood glucose monitor, whether that's something like a flash glucose monitor or a CGM, we've got so much more data than we ever used to have. We've got data about what happens when people are fast asleep. We've got data that really fills in the gaps. And like many people have said, this is the difference almost between a sat nav or driving with your eyes closed and only opening them every couple of hours. So we can have so much more insight into how a person's blood glucose is working in loads of different situations. And of course, because it's got that continuous monitoring function, we can start to get things like advanced warnings about when a hypo might be imminent or when your blood glucose is rising. All of these are incredibly useful. We can start getting much more in-depth data and really start thinking about the much wider picture of blood glucose, how it might interact, for example, if you are coming onto your menstrual period, or what happens when you're doing sport, what happens in different weather. You've got so much more insight. And then that allows for much more informed management decisions. And we know that where people are on insulin pumps in particular, that you can get into this really precise micromanagement that would never have been possible 5 or 10 years ago with much more basic technology around. So there's huge benefits here. And this isn't even starting to think about the benefits of closed loop systems, which we know have very, very good results at keeping people in range. So enormous biological benefits for people. But we know that the technology is not perfect as it stands at the moment. So we know that there's a risk of failure, and particularly if somebody is on an insulin pump, that if that pump fails, that a person can become very, very ill very, very quickly, and that's got significant risks attached to it. And I'm sure the minute you go onto any social media, there are always lots and lots of different posts about people who've experienced technical inaccuracies. And this is a really big issue with blood glucose monitors. We know that for some reason, sensors aren't always entirely accurate. And it's very, very difficult for a person that if your Libre is telling you you're 11, your blood glucose capillary check is telling you you're a 5, and you feel like a 3, which is the right answer. It's really, really difficult and confusing for people to know what their actual blood glucose is. And we know that when people have had a run of inaccurate sensors, for example, that can really put them in a position where they find it difficult to trust the technology and difficult to know what to do for the best. It's really important to stress that with all of this technology, somebody's life is quite literally in the hands of that technology at any given time. And so it's so important that the technology is giving us accurate information at all possible times. And then we know that another thing that people sometimes feel really worried about is that by wearing technologies, particularly having something like a Libre on your arm, that's a visible sign that they live with diabetes. And for young people in particular who feel very conscious of their bodies and how their peers might perceive them, that's quite often a reason why people choose not to have this technology on them. People don't want to be defined by living with diabetes. And if they feel very anxious about what other people might think, then it becomes very difficult for them. And we know for a lot of people, actually, this technology can increase their anxiety sometimes. So having lots of alarms going off saying that you're going hypo or you're going too high, if you are somebody who's naturally very easily worried about things, that this can actually cause an increase. And we know that for some parents, unfortunately, it has increased their anxiety about their child, because we know that on the Dexcom, for example, you've got the option for people to follow you via their phones. So we know that for a lot of parents, they find it difficult to let go of that when their child might be having a sleepover or going on a school trip or at school, Parents often find it very difficult to stop looking at those Dexcom reports and those screens and to let go of some of that. So although a lot of their anxiety might be reduced by the access to technology, it can have that counter effect as well. And we know that more and more people are experiencing this issue that's called alarm fatigue. So if your alarm on your sensor is going off over and over again, we know that people just naturally, we all do this, get absolutely sick of it. And so they're much more likely then to turn the alarms off or to change the range of the alarms, which can then start to compromise their diabetes management. And it means that the sensor isn't doing as effective a job. So these are all elements that we really need to think about when we're designing technology and improving existing technologies. And then we need to think about the wider picture. So these are the sociological aspects that technology comes into. So we've already talked about the benefits of improved sleep. So it's really important to recognize that these benefits are not just for the person with diabetes, but they're quite often for the people around them. So for parents, for partners, for people who live in the same house as the person with diabetes, there's also a knock-on improvement there, which has huge improvements in relationships and how everybody gets on within a home. And that reduced anxiety for the people who love a person with diabetes is absolutely enormous. So for parents to be able to know how their child is getting on at school and to be able to check in on a person's blood glucose is really, really important. And you see that similar improvement for partners, for loved ones, to know that there is additional technology that's looking after that person can be a massive, massive relief and reduce the general anxiety within a household. And of course, we know that wearable technology, so things like wearable pumps or CGMs or flash glucose monitors, can be a huge communicator of positive role modeling for people with type 1. So I'm sure many of us saw the pictures of Lottie Moss on the catwalk wearing her Omnipod recently. And that was a really positive moment for people living with diabetes. But it can also be incredibly helpful on a smaller scale. So if you are a child starting at school, for example, and you see another child wearing a sensor, that's immediately somebody that communicates to you that you are not alone with this, which is really, really positive. So while that visible communication that I live with diabetes can sometimes be a downside, for a lot of people, it can be a hugely positive experience. However, we know that there are a lot of failings on the sociological side when it comes to diabetes technology. So we know that it can be quite intrusive into relationships. So a lot of young people have real concerns about being found less physically attractive if they're wearing diabetes technology on a regular basis. And we know as well that things like alarms can be really intrusive if you're trying to be intimate with your partner and they suddenly go off everywhere. Has to be emphasized that this is less intrusive than a hypo when you're trying to be intimate, but still it's something that can really put people off. And we know, of course, that there can be a lot of conflict around this diabetes technology. So because a person can look at the graph that's either on your sensor or you might have them linked into your followers, there can be this lack of understanding sometimes by loved ones where they're seeing spikes or they're seeing trace lines that are very high and they start to question that. They're saying, why are your graphs so high? Why did you have that big spike? Why did you have that hypo? And particularly if those people who are doing the questioning don't really understand about diabetes management, that can feel quite difficult, and people might feel like they have a right to question you on your diabetes data, which we know is your own data and absolutely your choice about who you discuss it with and who you share it with. There's a more specific version of this, which is follower conflict. So we know that with lots of the sensors nowadays, you can choose to add followers in, so they can access your data from their phones. This is a really big issue for adolescents and young people with diabetes, because quite often they will be at school and they'll suddenly receive a text message from their parents saying, why haven't you done anything about this hypo, or why are your levels so high? And that can cause a lot of conflict within families. So a young person might feel like they're under surveillance the whole time. And if it's continually causing aggravation and conflict within families, young people are far more likely to reject the technology altogether. We know that data ownership is a really big thing now as well, because people can log on, whether they're in your diabetes care team or family members. People can see your diabetes data much more than they ever used to be able to. And so it can sometimes feel quite intrusive that people are looking at what is very, very personal information. And if there haven't been clear boundaries set about what the person with diabetes is comfortable sharing, that can then become a source of anxiety and potentially conflict. And back again to this idea of a visible communicator. So lots of people, although they can see the benefits of diabetes technology, don't want other people to know. And so the fact that at the moment these devices are very obvious on a person's skin, and it's really important to emphasize as well that a lot of these, well, all of these sensors are white. And if a person has darker skin, they are even more visible. These could all be additional reasons why technology uptake is lower or is more likely to be rejected. So we need to be able to offer people lower profile technology that is less obvious to the eye, and we really need to design technology in a wide variety of skin tones. So what you can see here are reasons that young people in the service that I work in have rejected technology outright, right from the very beginning, or have chosen to stop using technology. So there might be a general mistrust in technology. They might feel that actually I'm not handing over my diabetes management to a machine or an algorithm. I would rather do it myself, thank you. Or it could be that they have had a run of faulty sensors, for example, and that experience has really scared them, and they then choose to not go ahead and use that technology anymore. We've also talked in some depth about this visible sign, this visible communicator. So a lot of young people that I work with are just not up for that. We know that for young people in particular, the visibility and how they look on the outside is very, very important to them. And this might well be a reason for rejection. We know that information can feel overwhelming, particularly if somebody is already predisposed to feeling anxious or might have slightly perfectionist tendencies. Follower conflict is such a big issue for adolescents and young adults. And for the parents who are watching today, this is something that you really need to be aware of. So it's important for you to have the discussion with your young person and the diabetes team about how we establish boundaries around who's looking at the data and how we talk about the data from a young person sensor. We know that for a lot of people that technology can feed this narrative that I'm failing at diabetes, because there will always be spikes in somebody's graph. There will always be days where your bloods are all over the place and you don't really know why. We know that diabetes, and type 1 in particular, because it needs so much input when you're on insulin, it's really good at making you feel like you're failing. And we know that if you start to feel sensitive to this idea that I'm failing at diabetes, we know that diabetes technology and the readouts that you get from flash and continuous glucose monitors, it is really good at emphasizing the fact that you're failing, that your line isn't low enough, that your line isn't flat enough, that your time in range is rubbish. So if you get stuck into that side of things, it can really quickly start to lead to much higher diabetes distress and going into things like diabetes burnout as well. And we know that for some people, it is the ew factor. For some people, they just think, oh, I don't want that on my body. I don't want anything stuck to me. And we don't always know what the reason for that is. For some people, it might be something to do with a needle phobia. For some people, it might be the sensory side of things. They don't like particular textures or things stuck to them. And for some people, they just can't get over this idea, this ick that it causes for them. And that's okay. But it's something that we need to be thinking about when we're designing technology, that these factors need to be taken into account if we're going to avoid people rejecting them. Because in an ideal world, we want as many people on technology as we can possibly manage, because we know it really does provide excellent results. So as we move to the future, these are things that we now need to start thinking about much more. We need specific technology education courses so that people can make informed decisions about whether they want this technology and how they can get the best out of it. We need to start thinking about the suitability assessment procedures, which in a lot of areas are very, very archaic. We know that there are lots of local variations about who can get access to things like CGM or pumps or even the Libre. And so a lot of these assessment procedures need to be updated very, very quickly. We need to start thinking about increased adaptability options. So how can we really personalize this technology and get the most out of it when people are living very, very different lives? And what we're likely to see a lot more of is this increased interface with phones and apps and smart devices, which is all absolutely great, but we cannot lose the human side of this technology, that there are people behind this. And even if we have an all singing, all dancing system with a great app behind it that gives us loads of information, it's really important to recognize that people with diabetes will still need human support and to feel like they have a team around them. So just finishing with this quote, and it's something to bear in mind for the rest of today, that the test of the machine is the satisfaction that it gives you. There isn't any other test. So if this machine produces tranquility, it's right. If it disturbs you, it's wrong, until either the machine or your mind is changed. So in terms of diabetes technology being able to pass this test, we are definitely not there yet. We really need to think about the social and the psychological side of things, and that there are humans behind these machines that need to use them and need to rely on them. So it's time that the technology caught up with all of the glorious mess that is humanity. Thank you.
Thank you, Rose. And as ever, you can see why Rose is always asked back. Fantastic talk, as ever. There'll be links in the chat to the practical resources Rose has created, so please do use them. And if you're on Twitter, follow her as well at Dr. Rose Stewart, and you can see all her work, all the interaction she has, so definitely worth it.